Grace Mushimimana first received the earlier version of HPV vaccine when she was 12 years old, part of Rwanda's school-based immunization campaign. Now, more than a decade later, she's among the young women returning to receive a more advanced vaccine that offers broader protection against cancer-causing strains of human papillomavirus.
When I was younger, I received a vaccine to protect me against cervical cancer. Recently, I learned that there is a newer vaccine that also protects against a wider range of cervical cancer strains. So I was encouraged to come back and take it to strengthen my protection.
For frontline workers here in Biryogo, a Kigali suburb, the moment is part of a growing national effort to strengthen the fight against cervical cancer, one of the leading causes of cancer deaths among women in Africa. Nurse Umurunga Muton Candide Christine says the response from the community has been encouraging.
Initially, we used Gardasil 4, which covers 4 types of HPV viruses, and now we are using Gardasil 9. So we have 5 more HPV viruses that are being covered. That means we are targeting not only cervical cancer, but those throat cancers, anal cancers, and that some of the infections caused by HPV.
Rwanda first introduced the HPV vaccine in 2011, targeting girls between the age of 9 and 14. Since then, the country has maintained vaccination coverage of more than 90%, one of the highest rates in the world. Now, health authorities say the transition to Gardasil 9 marks a new phase in that fight, offering significantly broader protection against 9 strains of HPV.
Now there is no age limit for HPV vaccine. Now Gardasil 9, which is already out on the market. So actually people can be vaccinated from 9 years actually to 45 years. So if we have the chance of mobilizing so many doses, so why not actually to introduce the vaccine also to adult women so that all of them can have the chance of getting vaccinated and definitely eliminate this cervical cancer.
Beyond vaccination, Rwanda's strategy also focuses on screening and treatment as part of a global effort to eliminate cervical cancer. Francois Winyindi from the Non-Communicable Disease Division at Rwanda Biomedical Center says the country aims to reach elimination targets even earlier than the global deadline set by the World Health Organization.
The target population for this new initiative that we are implementing, combining screening and vaccination, the target age range is 23 to 29. The reason why these are, HPV is a sexually transmitted infection. And that age range, those are women sexually active, so that we think that they're transmitting more HPV infections. And if we manage to vaccinate them and do together the screening, we will cut that transmission chain, and even that will reduce saturating HPV infections in the population.
The strategy follows what experts call the 90-70-90 targets, vaccinating 90% of girls before age 15, screening 70% of women, and ensuring 90% of those diagnosed receive treatment. Currently, Gardasil 9 is being administered to women in 4 districts as part of its pilot phase. Officials say a nationwide rollout could make Rwanda the first country in Africa to include the advanced vaccine in its routine immunization program. However, the plan will depend on securing enough doses through donations from manufacturers and international partners, as the vaccine can cost around $170 to $300 per dose in many markets, making large-scale procurement expensive for developing countries. For survivors, the vaccine represents hope that future generations may never face the same battle. But while prevention remains the most powerful tool, the impact of cervical cancer is still felt by many women. Cervical cancer is the second leading cause of cancer-related deaths among women in Rwanda, right behind breast cancer. Officials at Rwanda Biomedical Center say that the nationwide rollout of Gardasil 9 HPV vaccine will significantly cut down on new infections and reduce incident rate from 24 to 4 cases per 100,000 women. Ethan Toshebia for CGTN, Kigali, Rwanda.